My name is Jack Kerrigan. I go by Jack. I'm the medical director of the pediatric epilepsy program at Phoenix Children's Hospital, which is associated with the Barrow Neurological Institute in Phoenix. The research that I have done over the last 15 years in hypothalamic hamartoma has really had two different areas of focus. One is outcomes or patient outcomes with regard to the surgical treatment of epilepsy. So that's a circumstance where we've applied different surgical approaches to the issue of treating the hypothalamic hamartoma. And it's really important to understand how those patients do in terms of seizure control and some of the comorbidities that this conference is focused on. Things like cognitive performance, how well are you thinking, how well are you remembering and learning, and then psychiatric issues. A lot of patients with hypothalamic hamartoma have behavioral problems. Rage behaviors would be the most classic kind of symptom. And it's important to know how patients respond to treatment with those problems. So that's part of my research. And then another focus of my research, which has been in a partnership with many different collaborators, has been tissue-based research, which is to say that when we have done surgery, then we have some remaining tissue. And with permission of the family and the patient, then we're able to study that tissue to try to learn more about it. And that's been focused on genetic discovery and genotyping. That's been focused on the pathological features, basically what does the tissue look like and what kind of cells live there. And then additionally, what's the behavior of the tissue, asking the question, what is it about this tissue that would make it cause seizures? So we try to understand the cells and the networks that those cells create and why they behave in a certain way to result in seizures. The long-term significance, of course, is the big picture, which is to improve the lives of patients that have hypothalamic hamartoma. It's a serious condition for a lot of the patients, and that makes it a very serious condition for the entire family. So basically, we're trying to help people that have this condition, and that's what it's all about. The international conferences have been critically important for the hypothalamic hamartoma community. And when I say community in that sense, I'm talking about the patients, the families, the clinical providers, the doctors and the nurses that are taking care of the patients, the psychologists, the behavioral health doctors, but also for the research community as well. Because a lot of the researchers, for instance, are PhD doctors who don't really interact so much directly with the patient, but they're doing the genetic testing or doing the neuropathological, electrophysiological, advanced technique scientific testing. And it's very important for all of those people to come together to make sure that we understand what kind of problems the patients are having, which leads to what kind of questions we should be asking with our research so that the answers are important to help the patients.